with Emma and Johanna, and we did a presentation on abdominal aortic aneurysm. So what is an abdominal aortic aneurysm? It is an enlarged area in the lower part of the major vessel that supplies blood to the body. This is known as your aorta. And the aorta runs from your heart down through the center of your chest in your abdomen, and it's the largest blood vessel in the body, and so a ruptured abdominal aortic aneurysm is pretty serious and it can cause life-threatening bleeding. It's a very common disorder. More than 200,000 cases per year are diagnosed in the United States. It's a very urgent medical condition. So some common causes would be atherosclerosis is probably the most severe reason that it is caused. And this is a disease in which plaque begins to build up in the arteries. It causes the strength of the aortic wall to decrease and the area of the aorta to enlarge in size because of the buildup. And you can kind of see, comparing the normal artery to a late-stage atherosclerosis, there's normal blood flow, but then cholesterol and plaque will begin to build up on the walls, causing swelling, and then not enough blood is able to get through. About 90% of the cases are degenerative, which means that the function or structure of the aorta weakens over time, and nothing really can be done about this because the symptoms usually go unnoticed by both the patient and the physician, and often it will become too late for them to treat before something bad happens or the aorta ruptures. About 5% of the cases are inflammatory, which just describes the inflammation of the aorta and how it begins to thicken. Some other causes would be high blood pressure, heredity, trauma, infections, and smoking. So some symptoms and assessment. It's important to recognize that about 75% of aortic aneurysms are asymptomatic, and so they're basically found by chance. But some common symptoms, if there are any, would be flank and back pain, discomfort in the abdomen. There's also abnormal bowel elimination, and then often pain will be experienced deep and constantly. So no matter what position you're in, if you're sitting, standing, a lot of times people will try and like roll over in different positions to get the pain to stop, but it's just going to be constant. And if the pain becomes really severe, it's very likely that the aorta is about to burst or will soon. So keeping this in mind, some physical exams that us as your doctors are going to be looking for is we're going to be examining the patient's abdomen. We want to use our stethoscopes to listen for any abnormal sounds, watch for signs of unconsciousness, pulse changes, and just be looking at their blood pressure. Sometimes abdominal aortic aneurysms can cause a decrease in blood flow to the legs, and so we want to be looking for any numbness, discoloration, or sometimes paralysis in rare cases. And we just want to know that we want you to know that we are going to be doing everything we can to help you and discover the cause of this and if it is the case in the patient. And also we want to offer a psychosocial exam because this is a very stressful time for both you and your family member, and your health matters to us too. So if you have any questions, we will be there to answer them and help out as best we can. So how to diagnose this? Since there aren't very many symptoms, abdominal aortic aneurysms are usually diagnosed through routine physical exams or often abdominal x-rays. And you can kind of see in this picture, the red arrows are outlining. It's really hard to see because you see the bones of the spine, but then you can kind of see the outline, and that's the bulb sort of shape of the aorta. And so doctors will look at that to look at any swelling and just see the shape of the aorta or the aorta. And so next, some treatments. Treatment largely depends on the exact size of the aneurysm, and there are 3 typical categories that this falls into. There's small, which ranges from 3 centimeters to 4.4 centimeters across. And for this, doctors will usually not recommend anything too invasive like surgery, but they will recommend lifestyle changes and check that usually yearly, sometimes monthly, via ultrasound, just to make sure that the aneurysm isn't growing and that everything is staying stable. And some of the lifestyle changes that they will recommend is to stop smoking and drinking, to eat healthy, exercise regularly, and maintain a healthy weight. For the medium aortic aneurysms, these are kind of a wild card because doctors, they're like in between the small and the large, which are very dangerous. And so doctors will usually first recommend lifestyle changes, but then they will also conduct monthly monitoring just to make sure that it's not growing or if there's a chance that it might rupture. Usually with 4 centimeters or greater, doctors will start to think about or recommend surgery for the patient. And this kind of leads to large aneurysms, which are 5.5 centimeters or more across, and these are extremely dangerous. They're basically, at any point, they could rupture with any stress-induced things, or they could just go on their own. So doctors will immediately recommend surgery, and there are usually 2 types for this. The first is open surgery, and this is mostly used in emergency cases or when they think that the artery is about to go. And what the doctor will do is make an incision on the tummy, and they will go in into the aorta and insert a graft that will clear out the plaque and cause a clear pathway for the blood to flow through. And then the second form of surgery is endovascular surgery. And how this goes is a graft is inserted into the blood vessels of the groin, and they're carefully placed up into the aorta and then expanded, which will kind of free the plaque and allow blood to flow through. So some kind of reasons why it's really important to understand the symptoms, especially for families and their relative who might be going through this. It's kind of a difficult thing to consider, but every year about, again, 200,000 people in the United States are diagnosed with this. So, sorry, I forgot to change it. But every year, 200,000 people in the U.S. are diagnosed with aortic aneurysms, and it is also the 15th leading cause of death in America. If you have a rupture, you have a very low chance of survival. And that might be really alarming to hear, especially since your relative might be going through this. But it's also really important to consider because it is such a bad thing that could happen, and we just want to make sure that they're getting the care that they need, and we're treating this with haste so that nothing bad happens and it doesn't rupture. But there is some good news. Surgical procedures have an extremely high success rate. About 95% of patients who undergo surgery recover and they're able to live their lives normally. So if caught early, it's a good thing, and mostly they are healed. So if you do choose to go with surgery, you and your patient or your relative and the family, usually we just want you to understand that surgery is really stressful, and we understand this. As a medical staff, we're going to be here to answer any questions that you have and support you with emotional support and counseling. It's also important to notice that 2 to 3 days in the ICU or condition stabilizes is how long the patient is going to be in the hospital, and usually this can range from a certain amount of time, so we just want you to know that during this time we are here to care for them and make sure that they're getting everything they need. And until the doctor recognizes that they are doing well and that they can be discharged, there are a few things that the family must be aware of. One of those is wound care. So the family needs to know and enforce that the patient keeps their surgical wound clean and observes any swelling, redness, or abnormal colors in the wound. And so just to recognize this and notify a physician if anything seems off. And then there are also activity restrictions. The family should make sure that the patient is not lifting anything heavier than 5 pounds for about 6 to 12 weeks. And they should discourage any activities that involve pushing, pulling, or stretching. Also, the family should encourage to stop smoking in the patient, as this is one of the main reasons that this is caused in people. And then also, should any arising complications occur, the family should encourage the patient to notify their physician immediately, because a lot of times patients will be insecure about it, or not wanting to go back to the hospital and experience surgery again. But it's really important because this is such a life-threatening disorder. And those are the rectals.